Nelson, and I'm a project assistant at Criminal Justice Institute at Community Resources for Justice. And I'll be moderating today's webinar, Data Collection at the Local Level. Before today, I would like to tell you a little bit about CJI. CJI provides nonpartisan consulting, policy analysis, and research services to improve public safety in communities throughout the country. CJI helps and promotes evidence-based practices which inform practitioners and policymakers, including corrections officials, police, political, and community leaders, to assist them in making criminal and juvenile justice systems more efficient and cost-effective, and promote accountability for achieving better results. On June 21st, CJI hosted a conference entitled Measuring Realignment Using Data for Management and Evaluation at the Local and State Level in Sacramento to assist key criminal justice stakeholders in California in their implementation of Assembly Bill 109. The presentation you're about to hear was one of the conference breakout sessions. So without further delay, it is my pleasure to introduce today's speakers, Tanya Heitman and Stephanie James. Heitman currently serves as Deputy Chief Probation Officer of the Santa Barbara County Probation Department's Adult Division. She has a bachelor's degree from Trinity University in San Antonio, Texas in 1988, and began her career with Santa Barbara County Probation in 1990 as a Juvenile Institutions Officer at the region's Juvenile Hall facility. During a 21-year tenure with the department, Tanya has served in a variety of capacities, which has enhanced her overall expertise in all areas of probation operations. She is a participant in the Joint Judicial Council of California Administrative Office of the Courts, Chief Probation Officers of California, SB 678 Data Collection Project, and is a member of the AB 109 Data Subcommittee. She has been instrumental in the planning and implementation of AB 109 in Santa Barbara County, working collaboratively with representatives from the Sheriff's Office, the offices of the District Attorney and Public Defender, and local community-based groups. Stephanie is currently the Chief Probation Officer for the San Joaquin County Probation Department. She has been with San Joaquin County Probation Department for the past 17 years. She has been an administrator for the past 9 years and has worked as the Assistant Deputy Chief of the Adult Division, the Deputy Chief of Field and Court Services, as well as Institutional Services, and the Assistant Chief Probation Officer. Her 9 years were in the Juvenile Division as a line staff and supervisor. Steph has a bachelor's degree in criminal justice, as a master's degree in criminal justice from California State University at Sacramento. Without further delay, I'm going to turn it over to Tanya.
Thank you. I want to preface my remarks today by acknowledging that me and the audience may be further along in the realignment evaluation process and doing some very innovative and exciting things. Santa County is certainly not the experts in this area, but we have to share what we've planned thus far and would hope that those in the audience would find something useful within it. For my portion of the presentation, I'm going to set the stage for how our data really came about and give you some background information and how we focus efforts. In doing so, I need to take you back to when realignment first passed. Being criminal justice professionals that we are, what was the first thing that we did? Well, of course, we asked ourselves, what does it say? What are we required to do to be in compliance with the statute? So let's take a look at Penal Code Section 17.5. It sets out some of the standards about outcomes. In paragraph A2, sets out some initial standards, and in A2 it tells us that nationally there's 40% of these offenders that recidivate, and that for California those numbers are worse. That's not particularly helpful for those of us that wanted to cut to the bottom line as to what we were supposed to measure. So we looked at A6, and it seems to establish that the Community Corrections Partnership, or what we typically call the CCP, is responsible for the outcomes. Well, that's no, but at this, if you're like me, you're wondering, what outcomes? They're pretty vague. Can I just tell my CCP what percentage of the PRCS offenders successfully completing their supervision and call it good? Well, really not we're not able to be that simple-minded about it. So with A7, we're getting somewhere here. It references a data-driven approach. What should I use? What data use? And could it be as simple as indicating how many PRCSs are coming out of prison and that guide how I spend the money? I would say data-driven. Fortunately, that's as far as the code goes in advising us as to what we should be evaluating and what data we should collect. Or many of us would love to say, well, I'm not required to do an evaluation, so we're done, right? But of course, those in the crowd that say, oh, let's take a closer look. Perhaps we shouldn't be so hasty. At who else was talking about evaluation across the state and what's they weighing in? We have the Legislative Analyst Office report, 11 Realignment, addressing issues to promote its long-term success. Tell us that the state needs to promote local accountability and that establishing useful accountability measures is critical to the long-term success of realignment. They identify some key elements pragmatic outcomes that will be needed to guide the local decision-making, as well as to advise the state and local officials as to how it's working. And certainly we have the general public and elected officials that want that information as well. We have all responded to some of these requests for information and data already, and are likely thinking, I probably have to beef up the amount of data that I can easily have available at my fingertips to respond to the requests and be as prepared as possible to show what we're doing. The LA report goes on to recommend tying fiscal incentives to good outcomes. They truly have my attention. The code does not currently require me to measure certain things. If they fiscal rewards for being able to show my county's good work, I want to be ready. Obviously, I'll want to be well positioned to reap the financial benefits of our successes. We looked at what other statewide groups were talking about data and evaluation in the early days of realignment. We have CPOC, or the Chief Probation Officers of California, as one. They're probably the first to begin collecting data from each of the counties and aggregating it to show what was occurring. They've done a tremendous job helping coordinate the data elements and definitions for the counties. Karen from CPOC staff are great advocates of evaluation and meaningful outcomes in data collection. Some of what CPOC is asking each county to report on in terms of the PCS offenders being released from each month, the types of closings occurring, the being sentenced under 70 of the Penal Code, and a breakdown of how many are being sentenced to jail only, no jail, as well as what's being referred to as the split sentences. We have the CSA suggested that we should collect and report on the number of current inmates in custody and their basic demographics, average sentence, average long sentence, etc. Really looking at the jail impacts. And the new Board of State and Community Corrections is also tasked with providing leadership for 109. They anticipate collecting information and data about correctional policies, practices, capacity, and needs. They want to look at how realignment impacts policies and practices and the progress of criminal justice in California. SEEK has also been involved in developing the realignment funding formula and county allocations and have been tracking these discussions as well. They're very supportive of the effort and would like to see the capacity to analyze data across the state, within the counties, and within the offender groups. There's no question that even though the statute doesn't strictly require it, evaluation and outcome measures are going to be to each county's success. Knowing and being able to articulate our needs as well as our successes are with question crucial elements. Note that there's national interest in what is occurring in California, and our data will likely help other states' efforts. So in Santa Barbara County, we will get on top of the data and evaluation wave that seemed to be coming our way. We want all of our local stakeholders to participate and assist in guiding our efforts. This was probably the best attended AB 109 or realignment meeting that we had. agency was eager to come and provide their input into the process. Locally, we had our Sheriff's Department involved, probation, of course, district attorney, public defender, our medical department, the courts, public health, social services, University of California, Santa Barbara, who's an evaluator. Our Board of Supervisors had representation, and our county executive office staff. Then came the hard part. We kicked off our effort by trying to answer some very basic questions. Why data? So as a group, we discussed some same issues that we just outlined. There was overwhelming concurrence. We want to collect data. So once we got past that, we moved on to data. We wanted it to be meaningful data. But we were also very aware that every element of data we wanted to collect meant someone had to spend time collecting it. So we had to weigh the value of that data element against how easy or difficult it would be to collect and attain. Some of the factors are going to be unique to your jurisdiction. For example, of super, this is data that's already available to us. We maintain it in our case management system. So if they wanted to know what each offender's conditions of probation were, which ones were subject to testing, drug testing, for instance, that's very easy data for us to collect. On the someone collecting data regarding the highest grade level in school that our offenders had obtained. We don't currently collect that data, so we weighed the usefulness of that data element and decided we didn't need that level of specificity. Our assessment provides some general education information, and we decided that was sufficient. The detail wasn't going to provide, in that instance, enough added value to make it worth the effort to collect. We made the concept of like to know versus need to know. We wanted to be committed to the need to know, and we're going to of the like to know when it was going to be too time intensive in order to collect it. So then we're talking about who will collect the data. Probation sure couldn't every data element. We were in a position to collect every piece of the puzzle, and frankly, it wouldn't have made sense for us to do so. So we talked about who would collect data. We weighed who collected that data, who had the best source if multiple agencies had similar data, and we assigned it to the agency that could most accurately and efficiently collect it. The question we moved on to was who would coordinate the data. One concept to coordination is that we wanted to focus on transactional data. It allows us to see from start to finish what is happening with an offender. So rather than just counting how many offenders, for instance, were placed on GPS, and how many offenders by GPS, we need to look at a specific offender and take offender Joe and know that he was placed on GPS at this point in time and that he violated his GPS by this particular type of behavior, and he either went on to be successful or unsuccessful. Data is that data that moves through each element of a particular offender rather than just aggregating the numbers. In order to have that transactional data, we needed to be able to have an integrated approach. Coordination, confidentiality, and security all end up overlapping. I willingly deferred to another agency. It was quickly agreed that for our county, was the appropriate agency to coordinate the data. We were the only ones that had contact with almost all offenders. So the jails didn't necessarily even know who all the PRCS offenders were. However, had case records on almost all of the aligned offenders. We were also the one agency that entitled to almost any data or information regarding the offenders, whereas the courts, for instance, were not necessarily entitled to the mental health or health information. So well positioned to receive all of the different agencies' data, map, and then identify it before out the door to evaluators. Probation was also well positioned to deal with the security issues. Now, I recognize this isn't necessarily true for every county, as some counties don't have, the department doesn't have their own IT unit. But for our county, our IT staff had the infrastructure and skill to be able to handle the security issues to the satisfaction of the other agencies. Because we needed them to have confidence that as they put their data in, that it wasn't going to be subject to any security vulnerabilities. Back now to data and who would collect it. I acknowledge Chief Wendy Still with San Francisco County. Chief Still and I had been involved in some data groups through CPOC, and at one of our meetings, she shared some preliminary work her county was doing. I was impressed. I used it as a template to get us started. We ended up focusing on the same exact data elements that San Francisco did, but we organized our tracker in the same way and used it to guide our work. So you can see that the tracker is quite in depth. It notes every piece and then identified who was collected, as well as when. When was it going to be collected? At every 6 months, at discharge, at sentencing, etc. So the stakeholder group actually worked through this and ensured that if a particular agency was identified to collect that data element, that exactly what it was going to look like and when that collection would be submitted. Team manager John Kuo created what is referred to as an entity relational diagram. As a program person, I actually have a passion for data. This diagramming really my brain process the information, but I understand that many of the IT staff are aware of this type of data mapping and that it's helpful from their perspective. I know that this mapping greatly assisted our IT staff within the various departments that were contributing data to move the process beyond what could be accomplished with my limited tracker. The characteristics of our data is that we're looking for the raw data so that it could be analyzed and configured in a lot of different ways. I like the fact that once the data is accumulated and integrated, we can sit and dice it any way we want. For instance, if EPOC defines recidivism as incurring a new law violation while under supervision, I can pull that out of our database. How the county defines recidivism as incurring a new violation within their discharge, we can pull that out too. I don't have to know all the questions in advance because I've accumulated the raw data very specific to the questions that will likely change. That would have limited what we were able to address. So our database is very robust in that sense. Probation was selected to coordinate the data based on our IT staff's ability to address the security issues. We did that is through a cloud. So anyone that has an iPhone or iPod is probably familiar with the concept of a cloud. Utilizing the same technology for our data storage. Although we don't call it the cloud, we refer to it as the fortress in the sky. A cloud makes it sound like all of our sensitive and confidential data could slip, that someone could slip into it. But of course, that isn't the case. We know that it's actually quite secure and it cannot be accessed by anyone other than our partner agencies for uploading purposes, not downloading. So we prefer to call it the fortress in the sky. It's very secure. We know that our agencies can put what they need in. No agencies other than probation can download from the cloud. Perspective, though the cloud was a good solution because it provided the service over the internet, so it also allowed our partner agencies to upload data securely from anywhere and from any device. We need to put requirements on our partners in their software or their hardware. It's very flexible. It allows us to validate and parse upload directly into the database to minimize manual data entry and human errors. I notice that our IT staff say a lot, we need to minimize human errors. I suspect they get tired of fixing stuff for me and my staff. We manage to routinely mess up. So we're trying to address this for 109. I think we might be able to still manage to screw some things up for them as they keep mentioning that there's need for cleanup, but this has gone an enormous way in minimizing that. We haven't really spoken too much about our evaluation team. We consider our program and our IT staff from each of our partner agencies as part of the evaluation team, as well as our CCP. They're assisting and providing feedback. I believe a large part of our success thus far is that we aren't planning in a vacuum. I sit down with one or two key people and formulate a plan. Rather, it's been very interactive and a collaborative process. So contracting with the University of California at Santa Barbara, UCSB, Dr. Sharkey and Dr. Meredith Cosden in particular are the lead researchers. They are an ideal match to our 109 needs. UC has a wealth of local experience that they bring to the table. They are risk assessment for our juvenile division, which is a gender-sensitive assessment that's utilized for juvenile population. Evaluators for our challenge and our ROP grants, as well as our drug court and our Prop 36 program. They've worked with us and the other local stakeholders on so many projects over some years that they come to realignment with a familiarity that's invaluable. They've also been involved in policy development and helped guide program development over the years. They participate in our Juvenile Justice Coordinating Council, as well as our CCP, and the core and our policy council groups that oversee our collaborative court programs. Most importantly, they've been involved from day one of realignment. We haven't had to work to bring them up to speed because they've been part of the discussion all along. So counties that maybe haven't selected a one of the things that you may want to take into consideration is an evaluation team that would be able to continue to support your county or has already been involved in the past, rather than focusing on somebody that may just come in and do this one piece for you. Moving our evaluation forward, some of the learnings and key concepts that resonate for us have to be clear definitions. We all know that we're talking about the same thing. It seemed frustrating at the time that every time we met, we seemed to be reiterating what something was or was not. For instance, the sex offenders are not part of the 1170 group, are not the same as PRCS offenders. But because we have been committed to clear definitions, every time someone was lost in the process, went in a different direction because they understood the data piece differently, it was a reminder that we needed to make that definition more clear. Transparency. There was a level of transparency that we all had to be okay with. We need to be open about what data we had and or how bad it was. We also needed going to understand that the data, not the specific details, but the general data would be transparent, where it came from and how it was collected. This goes back to that transactional data piece. We need the data across agencies to be integrated so that we could put the pieces together in a picture of that offender. No one agency has the full picture. We combine our data and integrate it so that it has meaning. For example, we know that the sheriff has 200 offenders, for instance, that might violate their EM conditions with a new law violation. In itself tells a story. What if we're able to match those offenders to their probation data and learn as a result that 70% of those offenders are all have underlying drug sales charges? Perhaps we are now getting that would aid us in making EM release decisions. Through integration of the data that a more meaningful picture presents itself. And understanding the limitations. We can only go as far as various departments, case management, and IT systems allow. Which departments had the ability to reconfigure reports or queries and had to go through their vendors. This is an enormous difference in how your project moves forward and at what cost. Can't stress enough communication. We got to a great start and then seemed to get sidetracked when we had to move forward on budget planning for next fiscal year. The more frequently we meet as a group or with our partner agencies, the more we seem to make. As meetings and discussions get placed on the back burner, things go sideways. It's also a factor with the other stakeholders. It's better to keep your CEO or AO on board with the process as well as your board of supervisors. So to give planning to work on a research team some ideas from our local scope of work for UCSB. See, it ranges from the widget counting to the big picture and the program development. Everything from reporting on the number and type of offender sentenced to county jail and state prison to the percentage of offenders employed at discharge. This is an example of the types of things that we're looking at. We're asking UCSB to as part of evaluation. To be able to analyze the connection between the success rate of a particular intervention and the client characteristics. So in the out years, we'll be able to differentiate how much of particular interventions we need to plan for and budget for based on the types of client characteristics that are good matches for those programs. We will ensure that the client is well matched with the intervention that's to be able to successfully aid in their rehabilitation. They also, as part of their scope of work, provide feedback to the stakeholders and make suggestions as to program implementation. And is, of course, all of the data for a final report. Kind of gives you a background of how we set up our evaluation, some of the planning that went into it, how we got the stakeholders at the table, and how we made some of our decisions. So we're going now as a county. Our sample data is going to UCSB by the end of the month. We're currently engaged in some cleanup efforts. I think we're almost done. Whenever you're aiming for transactional data matching that goes into that can create some cleanup that's required. For our county, in order to match the data on the 11 side, we look at the sentencing dates and as the offender's name to make sure that we have an accurate match. So one case management system having the wrong sentencing date can cause a red flag to go up that then manually somebody has to go in to double check and find if this is a match or not, or why the discrepancy exists. Also continuing our efforts to automate each agency's data. We want any anomalies in the data are identified and addressed. And of course, we'll continue to monitor the state-level discussions so that we're ready to, as I said, slice and dice our data to meet the various interests. I think that a statewide group, we would like to see every county aim for transactional data. I realize setting a higher standard for the data, but we believe it will be worth it in the long run for California to be able to provide that depth of analysis on client offenders. I see us continue to collaborate and coordinate. Whether from a small, a medium, or large county, our to share our progress and assist each other will be beneficial to all of us. Of course, we should be attending to the work to establish statewide definitions so that we can analyze what's working and not working across the state and continue to strive for improvements. So these opportunities, statewide work groups, presentations, discussions, I think will aid us greatly as we go forward and allow us all to really be able to compare and contrast what's happening and learn from each other's efforts and success. that kind of wraps up the history behind how we got started. And who I'm going to turn this over to now is really going to speak to where they went from here as they continued with their effort and some of the results of what they're seeing already. So,
Stephanie James from San Joaquin County completed a 6-month preliminary evaluation report on public safety realignment. And before I go into this presentation, I wanted to acknowledge Cam Bullock from the San Joaquin County Data Co-op and his team there, and then our probation staff, Rich Evans and Nicole Alvarez, for all their work in compiling the data. It's important to remember that this preliminary evaluation report is designed to center more on implementation and has limited outcomes due to the short period of time that realignment had been in effect and that we only had 6 months of data. There we go. For year 1 planning, our CCP decided to contract with the San Joaquin County Community Data Co-op. The probation department had already contracted with them for about 10 years, so we'd been doing extensive evaluation work with them already. Funds from our one-time planning grant took us on the following 4 goals. We wanted to identify the data collection variables. We would construct the AB 109 data framework. We wanted to provide training to the CCP members and all of our partner agencies, and really wanted them to construct the AB 109 logic model. A sample of what our logic model looks like, and I know it's really difficult to see, but maybe you can enlarge it. The logic model, as you go across the continuum, it focused on this situation. It lists all the different collaborative partners that we had. It went over different inputs, which included funding, the personnel that were dedicated to AB 109 activities. There's infrastructure and technology also listed there. The next column is the outputs and activities, and then we have our short-term outcomes and then our long-term outcomes, with our primary goal obviously being to reduce recidivism. Kind of similar to what Tanya has done kind of in Santa Barbara County, we also created a data collection framework. And this was critical that the framework be developed so that each of our agencies, each of our partner agencies, and I think we had 8 in our year 1 plan, knew what they were responsible for tracking and providing. We also put funds dedicated to data collection and evaluation efforts through the Data Co-op. To be able to track data on the overall approach, look at overall project outcomes and impacts, to perform data analysis, have the Data Co-op help us in preparing reports. With our primary goal being reducing recidivism, we really wanted to be able to look closely at the recidivism data. We also included key informant interviews where the Data Co-op's been going out and speaking with different collaborative partners. They're also speaking with some of our clients under AB 109 and kind of really being able to give us some anecdotal information to kind of supplement our hard data. Our data collection and evaluation process addresses organizational development, collaboration, and evidence-based principles. As with any other county, we had some initial data collection challenges. As previously indicated, we had 8 funded agencies. They all had their own database and their own tracking systems in place. Our own case management system did not really have the ability to run a lot of queries for us. We had a huge challenge with the times that the probation department and our office were collecting and submitting data. While doing ours on a up-to-the-minute kind of basis, the sheriff's office was delayed by a couple weeks. So it was really giving us some differences in the data, and it was very difficult initially. We also had inconsistent definitions throughout all the different agencies, and we had a really difficult time cross-referencing data. One of the solutions that we came up with is we created an access database. All data from all our funded agencies are actually funneled to the probation department. We've streamlined what is reported, and we kind of did that through creating a monthly data dashboard, which we started in January. So after a couple months of realignment and looking at the data, we realized that we really needed to do something a little bit more streamlined. And this is a sample of our data dashboard that we collected in January. And what we decided to do is to kind of try and track on a monthly basis, and we report it out on a monthly basis, but each dashboard report is for the entire quarter. To the outcomes that were the most critical to our county, and a lot of it involved impact. So look at the top left of this board. We talk about straight and split sentences. In San Joaquin County, this presentation didn't have the June data in it, but our June percentage of split sentences was at 76%. So in the first 6 months, San Joaquin County was at 61.5% of split sentences, and that's really important to us because it's important for our county. We want the offenders who are sentenced locally to county jail to have a balance between a period of incarceration and a period of supervision out in the community. Because our jail, as most jails in the state, don't have the capacity to just have a bunch of offenders serving split sentences. And then we also aren't being able to track their individual needs, link them up with support services, or start sending them to appropriate evidence-based programs to really affect the way they think and start changing their behavior, which in turn is going to affect and reduce recidivism. So in county, it's been very important to us, and we've done a lot of outreach with our criminal bench to kind of impress upon them the importance of this. Again, we were, in the first 6 months, been significantly higher than the statewide average, which is only right now, in the first 6 months, about 20%. We're at 61.5. The second little table that you see there are the numbers of S's, and we call them LCSs, which is the 1170H sentence people. LCSs for local custody supervision. And so we look at the numbers that have reported to probation and how many we expected. The numbers of the people that we expected, the difference between those that actually report is some of them have outstanding bench warrants we had to issue, some of them may have an ICE hold, some may have been transferred out of county, or some may actually be in custody pending new charges. So that's why there's the difference there. The middle table actually looks a little bit more at our bench warrant numbers. One of the things that we've been concerned with in San County are our bench warrant numbers, and we've put some measures in place to try and start addressing that in year 2. We looked at benches that are issued before they actually show up to start receiving services, through which we have all of our clients come to the assessment center, which I'll talk about a little bit more in a few minutes. And then we also looked at those who have a warrant issued after we have actually started already providing them supervision services. And statewide, in the 6 months, the bench warrant numbers were 7% initially, and about, I think it was like 4.5 for already started receiving probation services. In San Joaquin County, both of those numbers are about 18%. So they're clearly significantly higher than the statewide average, and it's something that we're trying to use data-driven decision-making in our Year 2 plan, which I'll talk about a little bit more later. The table on the bottom left are our jail impacts, and clearly we needed to be able to look at a glance at how AB 109 is affecting our custody in jail. So as you can see, we look at how many PRCSs have been processed, how many LCSs, and you can see on this first table they're the yellow, and it's very, very small. This was January through March. But the brighter green number are the parole violators, the 56s, and you see that was a significant impact to our jail. And so again, we use this data in developing our Year 2 plan, and so again we have some strategies put in place to try and deal with these jail impacts. And custody is the return to custody, and what the PRCSs, the LCSs, or the 3056 holds were returned to custody for a technical violation or for a new offense. This slide just from April to June, it's the same information. I just wanted to give you a better picture. So we put a formal report on the 6-month data collection efforts that we've done here in our county. And it's important to remember that this was a preliminary evaluation report, and it really focused on what we called the situation, the response, and the impact. Implementation successes were that we were one of the first in the state that had the Year 1 plan approved by the Board of Supervisors. We've had tremendous collaboration and partnership. We even have State Parole who attends all of our CCP member meetings and has been an active partner with us. Had improved communication throughout our county, It's resulted in lots of changes to policies, procedures, and practices, not just within our own department, but within other departments as well. And we've created a variety of new programs. When we started our assessment center, it was ready to go on October 1st, and we were like standing at the door waiting for our clients to show up. And it took about 2 days for our first one to show up. Some of our preliminary data on the post-release community supervision population. In the first month, we had a total of 536 PRCS offenders released, 19 reported to our assessment center, 95 initially failed to report, and the other 22, like I indicated before, had either ICE holds, new charges, or they were out of county. We broke down ethnicity so we would have a good idea of the demographics of who we were serving. We also looked at their risk level, and this was concerning to us. As you can see by the table here, 56.7% of our PRCS offenders that are at high risk for reoffending for a violent crime. So we use this data to help us develop our Year 2 plan, and we've put quite a few strategies in place for Year 2 to try and address these the violent that these offenders may have. That was important in our county is that we looked at arrests and what agencies were being impacted by those arrests. So we were able to look closely at that. And in the first 6 months, 13% of the PRCS offenders had been arrested for a new crime. In the first 6 months, we based our recidivism data on CPOC's definition, which at that time was conviction of a new arrest. And right as of that time, we only had 5 PRCS offenders that had been convicted, and we had only had 29 of our 1170H offenders released from the county jail, and none of those had been convicted. So while this recidivism looks extremely low, it's not all that accurate because, as you guys know, it takes a while to go through the court process now to get that conviction. So we'll have much better data that we can analyze at the 1-year mark. What our executive committee also decided is at the 1-year mark, we wanted to have a 3-tiered recidivism report and not just rely on that single definition. And this is kind of modeled after what CDCR is currently using for their recidivism. So we're going to be looking at how many have been returned to custody for a technical violation, how many they have been arrested for a new crime, and how many have been convicted for that new crime. So we'll bring that data at our 1-year mark. LCSs, as I indicated, we only had 29 released from county jail. For 6 months, we had a total of 278 cases sentenced, and 61.5% of those were split sentences. The average sentence was 3 years, with the longest sentence being 8 years. Now, that 8-year sentence occurred in like the first week of realignment, and since then we've done so much outreach with our bench that they're really, really working with us, and we're not seeing those really long sentences at county jail. One thing that's been important to me is when I'm meeting with the bench to kind of talk about the period of time we need for community supervision, is the probation department, we really want at least 9 months. If it's less than 9 months, it doesn't give us enough time to really start addressing their needs and referring them to all the evidence-based programs that they need. You know, high-risk offenders need about 200 hours of evidence-based programs to really start changing their behavior, and you can't do that in about less than 9 months. Because these numbers were so low, in the first 6 months, we really didn't put together any demographic information on this population just because it was so statistically insignificant. We didn't think it was that beneficial. The next area that we really looked at was the county jail and the impacts that they had. In the first 6 months, processed 1,217 AB-109 offenders. 9% of those were parole violators. And 350 inmates were returned to custody for either a revocation or a new crime. And the majority were parolees. Also really enhanced our programming for in-custody inmates out of the county jail, and you can see here some of the different programs that the Sheriff's Office has provided and the number of people who have taken advantage of those. What I think is most important to note there is 160 inmates received their GED, which is a huge accomplishment. We looked at correctional health care services. As you know, there's been a significant increase in medical care costs at the county jail to offenders remaining in custody a little bit longer, and so it was important that we look at that data. We hit a all-time high in March of 366 AB-109 offenders in custody, which represented about 29% of our jail population. Programs the probation department put in place to serve both the PRCS and LCS offenders was the high-risk unit. At the end of March, we had 278 cases there, and an additional 60 had outstanding bench warrants. Another program we put in place was our Day Reporting Center. We actually had that originally in place, and we expanded it with our Year 1 AB 109 funds. In the first 6 months, we had 86 cases referred there. The ages ranged from 20 to 54 with an average age of 29.7. 80% were male. 2/3 of the cases were assessed as high violent, and only 4 offenders did not complete. 2 were because they had revocations filed. 1 was sentenced back to state prison, and 1 was transferred to the high-risk unit. One of the things that was important to us is to look at their criminogenic needs and find out what the top 3 risk factors were for our DRC clients. And as you can see, it was employment, aggression, and education. And so as we move farther into realignment, we're trying to address those needs. Our Reporting Center has quite a few partner agencies there, and so based on their needs, we'll refer our clients to a variety of different services. So we have drug and alcohol services, job readiness, education. We have a school there that actually provides diploma as well as GED education services. We'll review the education, and then at this time we were doing the MRT evidence-based program, which is moral recognition therapy. The program that was put in place in our year one plan was a post-release supervision reentry court. And this targets offenders who have significant substance abuse issues. We have a probation officer who is assigned to the court program, as well as case managers. You can see the program went into effect in mid-January, so by the time of this data, we'd only had about 2.5 months of data, but we had 27 offenders, and the significant majority of them were in compliance with not just only the provider, but the case manager as well as the judge. 2.3% of the clients in this program were referred to substance abuse treatment, half were in residential, and half were in outpatient. I had spoken previously kind of about our assessment center, and our assessment center has 4 different agencies co-located in the same building. And so anytime we have a LCS or a PRCS released from custody, the first they do is they go to that assessment center. And we have patient officers who are assigned there who go through and they do the risk and needs assessment. They do supervision and a treatment plan, and then they get referred to the other co-located agencies. So one of those agencies is behavioral health services, where they provide not just mental health, but also substance abuse services. And you can see they served about 156 offenders. They were given a formal assessment, an average of 4.3 days after being referred, and 25 clients had medication assessment, and they can actually dispense medications down there. The agency that we send them to is we send them to Human Services Agency, who again is co-located in our assessment center, where an eligibility worker will actually meet with the client and screen them for eligibility for any of the programs that they offer. As you can see, a significant increase in general assistance, and it's not because we have new offenders in our community. All of these PRCS and LCS offenders, they would have been here anyways. The difference is that we have a very efficient system now where everyone is automatically screened, where previously they had to go on their own to HSA, they had to go on their own to behavioral health, they had to go on their own to WorkNet and try and get those services. So a lot of them slipped through the cracks. So we're efficient and streamlined with trying to get them the supportive services they need to be successful. As I indicated, WorkNet is also in our assessment center, and they offer a variety of services, including workshops, the clients on obtaining their I-9 right-to-work documents, and help with job assistance and training. So you can see most of our clients participate in an average of 3 different workshops, and we actually also have a full-service computer lab there as well that all of our clients can take advantage of Monday through Friday, 8 to 5. 14 clients secured 9 right-to-work documents in that first 6 months, and actually 6 of them had already secured jobs as well. So that was a huge success for us. County Education, they provide education services not just at our Day Reporting Center, but also at the county jail. And I already kind of talked about that 85 clients had enrolled in GED and 8 had actually completed. Now, looking forward to our one-year evaluation effort, because what we'll be doing then is we'll be doing a little bit more of a longitudinal tracking of outcomes, including recidivism data. We're going to focus on what services might affect recidivism, such as the risk level, employment status, housing status, substance abuse issues, and mental health issues. We're going to do some evaluation work centering on cost effectiveness. Again, we're going to include those key informant interviews, and we're going to do some collection and analysis of police crime data. Now, these next steps have actually, most of them have been completed over the last couple months. What we did in our CCP is we really relied on this 6-month evaluation report to do some data-driven decision-making. We use this data to update our needs assessment as well as identify our gaps in services. Submitted proposals for additional programs for year 2 to fill those gaps in services and address those needs of our clients. The Executive Committee voted on funding those proposals actually last week on August 11th, and we plan on going to our Board of Supervisors on September 25th. They're voting on the final plan, our Executive Committee, on this month. Pretty much sums up what we did in the first 6 months and how we're using that data to help guide our services and move through public safety realignment.
Thank you. I just want to take a minute to thank both Tanya and Stephanie for taking time out of their very busy schedules to present this really really helpful information, and we hope that you enjoyed today's webinar. Thank you.